The Chimaera Labs Podcast, Season 1, Episode 1, The Disorder of M.E.N, featuring Cyan and Nareik, voice acted by Camille, Vail, and Kieran Doolabh.
Hey, Nareik, what you experimenting on now?
It's Dr. Nareik to you, but if you really are interested, I'm researching the endocrine disorder known as multiple endocrine neoplasia type 1, or M.E.N for short.
Ha! I always knew men were a disease.
Excuse me?
I'm kidding! Hey, I actually know some stuff about that disorder. I can help.
Well, you are my assistant. That's your job.
Okay. What have you gotten so far?
The disorder's original name was Wermer syndrome because in 1954, Wermer was the first person to describe the disorder as a striking clinical entity. Multiple endocrine neoplasia has its current name since when divided up, multiple means more than one, endocrine means it involves the endocrine system, and neoplasia is the formation of an abnormal growth of tissue. When put together, the name is just what the disorder is, the formation of multiple tumors on the endocrine glands.
Right. Also, M.E.N is naturally inherited, which means it's passed through genetics. When someone has this disorder, multiple endocrine glands develop tumors and become hormonally overactive. These glands are most often the parathyroids, pancreas, or pituitary glands. M.E.N can cause hyperparathyroidism, which is a long word that means the glands are overactive.
After researching, I've discovered that there are multiple hormones involved. A few of them are insulin, which lowers blood sugar and is produced in the pancreas. Its target organ is the liver. Somatostatin, which restrains secretion of endocrine system hormones, is produced in the pancreas and duodenum. Its target organ is the anterior pituitary gland, and it keeps the release of endocrine system hormones in check, releasing them only when they are needed and stopping their secretion once there is enough. Without this hormone, other endocrine system hormones would have no restraint and be continuously released. By keeping hormone systems balanced, somatostatin helps maintain homeostasis.
Right, and there's also prolactin, which controls the formation of breast milk and affects fertility and bone strength, produced in the pituitary gland. Its target organ is the mammary gland. Prolactin controls and initiates the formation of breast milk via the mammary glands. Prolactin concentrations increase when a woman breastfeeds and fall once she is done. It also reduces fertility, which protects lactating women from a premature pregnancy, which the body may not be ready for yet.
Then there is the adrenocorticotropic hormone, also known as ACTH, which stimulates the adrenal gland to produce cortisol, which helps reduce inflammation. It is located in the pituitary gland, and its target organ is the thyroid gland.
I remember that there is a long list of symptoms, including but not limited to abdominal pain, anxiety, a bloated feeling after meals, fatigue, headaches, and vision problems. Multiple endocrine neoplasia type 1, man, that's a mouthful, is diagnosed by a thorough examination of medical and family history, as well as a physical exam to look for signs of excess hormones. After this, a blood test is drawn to check hormone levels, and screening tests may be done to look for endocrine system tumors. What are you doing?
Checking to see if you have the disorder, of course. People don't always know they have the disorder, since in some cases, symptoms do not show up at all. If symptoms do show up, however, doctors, like me, will be able to diagnose the disorder when the patient mentions it.
I haven't mentioned it, though.
You just listed some symptoms a few moments ago. Anyway, the treatment for M.E.N, which is often chosen, is to remove the deceased gland through surgery. However, a medication called bromocriptine may be used for pituitary tumors rather than surgery. When entire glands are removed or not producing enough hormones, hormone replacement therapy is provided. For parathyroid glands, entire removal of these are not done initially due to the necessity of calcium production regulation.
I don't have multiple endocrine neoplasia type 1.
You're right. You just tested negative.
Nareik, M.E.N is rare, only occurring in 1 out of 30,000 people. Of course I don't have it.
Whatever. And it's Dr. Nareik to you.
Help me, I work for a mad scientist.
We would like to thank the following resources for this episode. The internet, specifically Google search, not sponsored. To learn more information about multiple endocrine neoplasia type 1, you can search these websites. www.bbc.co.uk/men-1/care-nail-uk/bbc.co.uk/gcse /GC/SE/PE_PE_supplement/HUA_hormones/1.SA/Cyan
Thank you for listening to this episode of the Chimaera Labs.